Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Kidney cancer. Introduction. Kidney cancer is a type of cancer that starts in the cells of the kidney. It is a relatively rare type of cancer. The earlier kidney cancer is detected and treated, the more likely are the chances of a successful treatment. This program focuses on the most common type of kidney cancer, renal cell carcinoma. It discusses what kidney cancer is and what treatment options are available. Kidneys. Most people are born with two kidneys. Kidneys are bean-shaped organs located in the middle to lower back on both sides of the spine. Your kidneys are part of the urinary tract. They make urine, which then flows through tubes called ureters to be stored in the bladder. The kidneys control the amount of fluid we keep in our bodies. For example, when we drink more fluids than we need, the kidneys secrete extra urine. On the other hand, when we do not drink as much fluid as we need, the kidneys make less urine. The main function of the kidneys is to filter harmful chemicals known as toxins from the blood. These toxins are secreted into the urine. When the bladder is full, people feel the urge to urinate. The urine is emptied through the urethra. The kidneys help to regulate hormones that strengthen our bones and produce red blood cells. They also help to keep our blood pressure regular. Attached to the top of each kidney is an adrenal gland. The adrenal glands make hormones that help control heart rate, blood pressure, and other important body functions. A layer of fatty tissue and an outer layer of fibrous tissue surround the kidney and adrenal gland. Kidney cancer. The body is made up of small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way, causing an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancerous cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. For instance, tumors in the kidney may grow through the kidney's outer layer to reach nearby blood vessels and tissues over time. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the kidney will always be called kidney cancer, even if it spreads to other places. Another name for kidney cancer is renal cancer. The most common type of kidney cancer is renal cell carcinoma. This type begins in the lining of tubules in the kidney. The tubules filter the blood and produce urine. Other types of kidney cancer are less common. Children are more likely to develop a type of kidney cancer called Wilms tumor. This causes a tumor to grow on one or both kidneys. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Risk factors. It is usually impossible to specify the cause of cancer in an individual patient. However, we do know what causes cancer in general. Healthcare providers also know risk factors that can increase the chances of getting cancer. Smokers are more likely than non-smokers to develop kidney cancer. The risk is higher for those who smoke more cigarettes or for those who smoke for a long time. Obesity also increases the risk for kidney cancer. Having high blood pressure may increase the risk of kidney cancer. People with a family member who had kidney cancer have a slightly increased risk of getting the disease. There are also certain conditions that run in families that can increase the risk of kidney cancer. For example, VHL syndrome is a rare disease that runs in families. People with VHL syndrome have an increased risk of kidney cancer. Not everybody who has risk factors for kidney cancer develops kidney cancer. Some people who have no risk factors for kidney cancer can still develop the cancer. Symptoms. One common symptom of kidney cancer is blood in your urine. This can make your urine look rusty or darker red in color. Other common symptoms of kidney cancer are pain in your side that doesn't go away, a lump or mass in your side or abdomen. Symptoms of kidney cancer can also include weight loss for no known reason, fever, feeling very tired. These symptoms may not be caused by kidney cancer. Make sure to see a healthcare provider to find out what is causing your symptoms. Diagnosis. The best way to treat kidney cancer is by finding it early. If you have symptoms of kidney cancer, your healthcare provider will try to find out if kidney cancer is the cause of your symptoms or if there is another cause. Your healthcare provider will ask you about your family medical history in addition to your own. You may also have urine or blood tests to rule out other causes of your symptoms. A physical exam will be performed. An ultrasound may be done to diagnose kidney cancer. An ultrasound uses sound waves to create pictures of the inside of the body. Tumors can show up on a CT scan. A CT scan is an X-ray machine linked to a computer. A CT scan takes a series of detailed pictures of your organs. Contrast material may be injected to make abnormal areas easier to see. An MRI is also used to make detailed pictures of areas inside your body. It uses strong magnets to create the images. You may receive an injection of contrast material. IVP is a procedure in which a dye is injected into a vein in your arm. A series of X-ray images are then taken of the kidneys, ureters, and bladder. This can show a tumor or other blockage of these organs. A biopsy may be performed to diagnose kidney cancer. A biopsy is a removal of cells or tissue for examination by a pathologist. A pathologist will examine the tissue under a microscope to look for cancer cells. A biopsy may also be taken during surgery to remove all or part of a kidney tumor. A biopsy is the only sure way to know if cancer cells are present. Staging. If you have kidney cancer, your healthcare provider will determine the stage of the cancer. Staging is an attempt to find out if the cancer has spread, and if so, to which parts of the body. Stages are usually described using the numbers 1 through 4. A lower number indicates an earlier stage. Staging is helpful in deciding the best course of treatment. When staging kidney cancer, your healthcare provider wants to find out the size of the kidney tumor, whether the cancer invades nearby tissues, whether the cancer has spread, and if so, to what parts of the body. These are the stages of kidney cancer. Stage 1. The tumor is no bigger than a tennis ball. Cancer cells are only found in the kidney. Stage 2. The tumor is bigger than a tennis ball. Cancer cells are only found in the kidney. Stage 3. The tumor can be any size. It has spread to at least one lymph node, or it has grown through the kidney to reach nearby blood vessels. Stage 4. The tumor has grown through the layers of fatty tissue and fibrous tissue that surround the kidney, or cancer cells have spread to nearby lymph nodes or to the lungs, liver, bones, or other tissues. If kidney cancer is spread to nearby lymph nodes, it can spread to other areas of the body. Kidney cancer can spread to other lymph nodes. It can also spread to the bones, liver, lungs, and other tissues. Certain blood tests can help your healthcare provider determine which stage of kidney cancer you have. Some people with kidney cancer have high levels of calcium or LDH. A blood test can show how well your liver is working. Chest X-rays, CT scans, and MRIs can also help determine the stage of kidney cancer. These imaging tests can show if cancer has spread to other parts of the body. Treatment and supportive care. The type of treatment used depends on the size of the tumor, the stage of the disease, and the health of the patient. Treatment for kidney cancer may involve surgery, targeted therapy, biological therapy, or some combination of these treatments. Radiation therapy may also be used. Surgery is the most common treatment for people with kidney cancer. The type of surgery depends on the size and stage of the cancer, whether you have 2 kidneys, and whether cancer was found in both kidneys. Surgery for kidney cancer may involve removing all or part of the kidney. Surrounding tissue may also be removed. For people who can't have surgery to remove part of the kidney, cryosurgery or radiofrequency ablation may be an option. Cryosurgery involves freezing the tumor. Radiofrequency ablation uses a probe to kill cancer cells with heat. Targeted therapy is sometimes used for people that have kidney cancer that is spread. This therapy uses a drug taken by mouth to shrink a kidney tumor or slow its growth. People with kidney cancer that is spread may receive biological therapy. Biological therapy is a treatment that may improve the body's immune system against cancer. This therapy is injected to shrink a kidney tumor or slow its growth. Radiation therapy uses high-energy rays to kill cancer cells and stop them from growing and spreading. The radiation that treats the cells comes from a machine that aims the rays at a specific area of the body. There may be clinical trials available for people with kidney cancer. Clinical trials test new medical approaches and treatments. Kidney cancer and its treatment can lead to other health problems. It is important to have supportive care before, during, and after cancer treatment. Supportive care is treatment to control symptoms. It also is treatment to relieve the side effects of therapy and to help you cope with emotions. Supportive care also deals with the pain associated with cancer and its treatments. Your healthcare provider or a pain control specialist can suggest ways to relieve or reduce pain.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Kidney cancer is a relatively rare type of cancer that starts in the cells of the kidney. Treatment options for kidney cancer usually include surgery, targeted therapy, biological therapy, or some combination of these treatments. Radiation therapy may also be used. Kidney cancer is most treatable in its early stages. Research has already led to advances that have helped people live longer, and research continues to find better ways to care for people with kidney cancer. Thank you for using Explain.